So we've got a new segment on the show. It's called Notes from the Practice Accelerator. This is a program that we started really to help practitioners to actualize and create more efficient functional medicine practices. A couple of pieces of news from the week. So I don't know if anyone saw this, but Amazon is now in the supplements business. And, you know, this, in the same way as Jeff talked about with the labs today, I think what you're starting to see is that it's going to become really clear that, you know, the pricing, there's going to be really transparent pricing on supplements. And I think it's going to be harder and harder to be able to base your value as a provider on the supplements that you sell. And I think that one of the things that we've looked at through our membership course, through the Accelerator, is you need to have a business model that values you, the person, your education, your time, and not other stuff that you just happen to sell. That was just part of, you know, Functional Medicine 1.0. Bob Roundtree spoke at the Integrated Health Symposium, and he was talking about non-acute fatty liver disease, and he was saying in the first iteration of his practice in like 1982, when he realized that people needed milk thistle, he literally had a jar of it, a jar of the actual herb, and he would have people chew it because, you know, a tablet or a tincture was still years away. No one was making it. This was 1980. And so you can see that medicine's evolved. It made sense for everyone to keep supplements in their practice and to mark it up. And some people, maybe it even made sense to like not make money on the visit so you can make money on the supplements or whatever. 3 years ago in the Functional Forum, I said, look, there's going to be a time when it's not going to be cool to make money on supplements. And I think that this shows that, as you know, I think we all thought functional medicine is going to grow and it's all going to be happy and dandy. This is the beginning of the innovation in the space. This is the beginning of the disruption in the space, and big players are going to be looking at predictive preventive medicine and saying, I want a piece of that. And so it's going to lead to better outcomes for the patient, but we may have to realign our business models. And the second thing that came out today, just to say, 2/3 of Americans see doctors who are paid by drug companies. You know, again, this came out today. The Drexel University study. We should be on this. We should be educating in every zip code of America that 2/3 of doctors are on the payroll. I'm not. Come and see me, right? It's maybe as simple as that. Okay, so other big news about the Accelerator. So back in September, we had Dr. Terry Walls come and speak. She was doing her functional medicine MS reversal program in the VA, and she said, by doing the care as a group, you have that cross-pollination, the insights, the aha moments. Now that I've done it as a group, I'll never do it individually again. You know, this is pointing towards a new way of practicing participatory medicine in groups. Part of the reason why we had to talk about community. So I've got some exciting news is that Terry has now left the VA and is coming into our Accelerator and going to work with our Accelerator community to be able to create a group structure for MS, but for all of these other chronic diseases, because we're seeing that doctors and practices that are creating groups are able to make it available for everyone, make it cheaper, and to also do it. So it's a cool thing that we have going on there. We're also helping doctors to actualize and operationalize some of the technologies. So if you're thinking about what are you actually going to get patients to pay for, paying for things that help them feel like they're getting a ridiculously high standard of care is something, and Nudge Coach is one of those tools where you can actually see what people are eating between their appointments, see whether they're exercising, see what they're doing. You know, the food journal is dead, and Nudge is here to stay. So one of the things that we've been talking about in our practice accelerators, is there a predictable way for any practice to start and to build a successful practice and to bring in patients consistently, where you can literally turn up the tap and turn it down. And what we're starting to see is some best practices in the industry is that once you have your practice niche and you know the kind of patients you want, maybe it's cardiology patients, there is something going on the corner of Facebook ads and Eventbrite where we can literally put on a series of events in a community. There are people looking on Eventbrite for events anyway, but then pushing Facebook ads that are targeted to, let's say, women between the ages of 40 and 70 who live within 10 miles of your practice, who happen to like Mark Hyman, Josh Axe, Mind Body Green, and if you're doing an autoimmune one, the Lupus Association of America and the, you know, I don't know, colitis, patients like me, things that they've already self-identified themselves on Facebook as liking certain things. We can get them into our practice. Eventbrite gets them to the event. It also captures their email and phone number. You can set up reminders. You can do an event to get them into your practice and follow up. These are the kind of things that we're talking about in the Practice Accelerator. And what we're really trying to do is to create for any physician a step-by-step guide to build a functional practice, delivering the kind of care that Jeff's talking about, and delivering this evolved level. So if you're interested in the Accelerator, go and check out goevomed.com/accelerator. We used to have sponsors on the show. Now we're the sponsor, and it's the Evolution of Medicine Practice Accelerator.